So our next speaker is Dr. Poornima Prabhakaran. She is the Director of Center for Health Analytics Research and Trends, Trivedi School of Biosciences and Ashoka University in India. And she was before as the Director of Public Health Foundation, working as a Director for Center for Climate Change, right? In Public Health
Environmental Health
Foundation of India. Thank you, Poornima. So I have a question for you that you have so much experience in working in this specific area, I mean, climate change and health. So you'll be, please tell us about your South Asian, how South Asian countries are participating in terms of, allocating the NDCs, including at India, to advance a climate adaptive or resilient health systems.
Yeah. First of all, good evening, everyone. And I want to record my appreciation to the organizers, Professor Afsana, Bidan for the introductions, and the Global Climate Innovation Hub for the opportunity to host this very important dialogue in this platform. At the outset, we've heard about the SDGs from Professor Afsana, and we heard the context setting and then a real research study in the area. But I want to just take you back one step to reflect on the NDCs, the nationally determined contributions. And for most of us, this is no news, but just to bring everybody on the same page, the nationally determined contributions are country commitments to emissions reductions to deal with climate change. And as per the Paris Agreement, the countries, every nation is supposed to update these nationally determined contributions every 5 years. So a couple of years ago, just before, at the Glasgow COP in 2021, there was a fervent appeal actually to all nations to reconsider and enhance their NDCs, simply because of the increasing recognition that there was a gap between what is being committed and what is required to actually achieve the 1.5 degrees Celsius, if not the 2. So really what happened after Glasgow is the question that we've been asking in terms of the NDCs. And not all countries submit at the same time. They do it at their own 5-year cycle. And for us working in the health sector and as professionals working with people in the health sector, I think what was most important for us to understand was how much of the NDCs reflect or take into account the linkages to health and health systems, which is the focus of our conversation here. And thankfully for us, there was this stock take of the NDCs in South Asia after the Glasgow COP by the Global Climate and Health Alliance, which many of us working in this space are now familiar with as the organization that has this convening power to bring together health professionals from around the world. And they actually did this study to look at evaluate the NDCs that had been submitted from October 1st, 2021 till September 2022. And what they really did was to look into these NDCs. It was about 54 countries NDCs, and evaluate how much of these NDCs are accounting for health. And they formed, as a report, the Healthy NDC Scorecard. And what it did was look at 6 categories of evaluation in this assessment. They looked at integrated governance. They looked at health impacts. Was there any mention of health sector action? Was there any mention of co-benefits for climate action, health co-benefits of climate action, economics and finance, and monitoring and implementation? So each of these 6 categories was given a score of 3, so that we had a score of 18 for each country. And along with this, there was also a climate tracker assessment, which was actually looking at, in addition to the insights into the health mention in the NDCs, was there also progress in the overall climate ambition of countries? And this actually was important because sometimes there was a mismatch in what they were committing to in their NDCs, but also what they are doing in terms of overall climate ambition. So it was interesting what came out of this exercise, and I just picked the countries that were there in this exercise from South Asia region. That's our region of focus for this conversation. And you will see here the scores that countries like Cambodia, Indonesia, Myanmar, and Nepal had. And out of a score of 15 sometimes, because there wasn't data on a particular indicator, you can see the commitments and the linkages to health in country NDCs for small countries like Cambodia. Cambodia, Indonesia had somewhere, halfway in terms of achievements of linkages to health in their NDCs. Nepal had a score of 3 out of 15, and I'm not sure that's completely reflective of what is happening in that country, because most of us know, and Dr. Dinesh will endorse that there is a lot of work that's happening to develop climate adaptive health systems in Nepal. So while this exercise did try to kind of assess countries for their commitments and assessment of linkages to health, it also gave us a kind of a perspective in comparison to the developed nations. Look at the scores that UK or the United States of America or even the UAE, the current host of the COP, had. Or a developed country like Singapore in South Asia also scored very poorly. So it gives us food for thought in terms of what are countries committing to in their NDCs. Are we really understanding the linkages to health? And from coming from a health day that we had in COP, is this something that we need to advocate for? If the commitments are not happening at country level and they are not seeing the linkages to health, then we all have a lot of work to do still. And I think what I took away from this also, the barometer that you see over there is actually the climate tracker assessment. So while Singapore scored poorly in terms of its linkages to health when it was talking about its NDCs, it also meant that it was catastrophic for health in terms of its overall climate ambitions. And that's not a very interesting fact for us to digest over here. And I think what we also started thinking about is, okay, if the countries are including health, are drawing the linkages to the health impacts of climate change, and also talking about emissions within their health sector, what are they expected to do next? And as we all know, we are all interested in developing climate resilient and adaptive health systems. And where do we go from here? This is where I want to bring a country example. I think overall what we need to do in order to build resilient health systems is first understand our vulnerabilities. Every country is different in terms of vulnerabilities, though you did say in South Asia, we do have similar vulnerabilities. India, for example, where I come from, we often call it countries within a country. Every state in India has its own climate risks and vulnerabilities. So understanding our risks and vulnerabilities, there are many tools out there. The WHO itself has a list of indicators for assessing our risks and vulnerabilities. And then go on, like Farzana mentioned, to develop our health national adaptation plans. And again, we have a lot of resources out there. Draw from WHO frameworks, the World Bank has its own framework. We need to develop our, not just national adaptation plans, we need health national adaptation plans. And once we have those, I think very decentralized implementation and governance is important for implementation on the ground. And of course, we need resources, optimal allocation of resources, and I hope multilateral banks or the other people who hold those money bags are listening to this, because this is important. We might have our NDCs linking to health. We might have our health national adaptation plans. But at the end of the day, for many of us, and South Asia region, this is very true, there is not enough climate finance to actually do the implementation at the end of the day. And I want to just call on the example from India, because we have a flagship national program for climate change and human health, which is hosted by the nodal ministry, our Ministry of Health. And this happened in 2015. The national program was established, but we quickly went on then to develop our national program for climate change and health with its framework for the national adaptation. And this was implemented in right earnest from 2018, but I was closely involved in the climate resilient health systems framework, and we started talking to them of not just, I used to use the term climate smart, which encompasses both resilience or adaptation as well as mitigation. And I think what we did was moved on to think about not just climate smart, but also sustainability in healthcare. And we did a lot of resource development for the country, which was used even during COVID through virtual webinars to sensitize the actors on the ground on what they need to do to develop resilience of their healthcare facilities. And I just want to flag also that we also did a top-down approach. Unless we bring this into our curricula, this cannot move ahead. And so we have a subcommittee now which is looking at bringing climate change and health into curricula, not just in the medical council, but also in the 5 other councils: dental, nursing, pharmacy, as well as the Indian systems of medicine. And this is just a snapshot of the framework that I have been closely working on to develop climate resilient and adaptive healthcare facilities. It takes into account a lot of different indicators, from site selection to building and infrastructure being resilient, natural resources like energy, water, and food being used optimally, as well as things like sustainable procurement. And the approach that we use is a very decentralized and customized approach for every state. And I just want to close with the key takeaways that we do need our national commitments to take into account health, but it must underpin the UNFCCC principle of common but differentiated responsibilities. Every country can't do the same thing. And we need to keep that in mind. Emphasis on the health co-benefits of climate action, facilitating countries in their journey towards climate adaptation, learning from best practices, mobilizing climate finance, and of course, platforms for learning like the knowledge platform that you mentioned. We also established one called the Consortium for Climate and Health in South Asia, again, a platform for cross-learnings and taking the agenda for climate and health forward.
Thank you so much, Poornima. I wish I could give you more time, but it's over. And but can you give us any example of any country that actually did a very good health system due to the climate change? Any single country?
Health system
just name
adaptation. I can give an example from my own country, from India. So in 2018, the state of Kerala, which is in the southern part of India, really faced the worst floods that we could have seen in that country. The primary health centers, which are the front runners of delivering healthcare services, were simply washed away. And rebuilding and coming back from that experience, I think what the state government did was to take into account historical flood levels, for example, and rebuild the PHCs, the primary health centers, taking into account what the flood risks are, but also simple things like moving away medical stores, the supplies, to the higher floors of the center, moving emergency services to the higher floor, having some barriers for the floodgates, so those kind of things. I think there's little examples which we document as case studies, but there are several more to learn from. So
thank you so much for your presentation. We learned a lot. Thank you.